Welcome to today's CSCRS Research to Practice Bites webinar on peer influence and perceptions of safety, I'm delighted to be joined today by Jill Cooper, co-director of the Safe Transportation Research and Education Center at the University of California at Berkeley, one of our key partners in this work. So we're glad to have Jill here. I'm Dan Jeline. I'm with the UNC Highway Safety Research Center. I'll be hosting today's webinar. If you're not familiar with the Collaborative Sciences Center for Road Safety, or CSCRS, our mission is to accelerate progress in reducing transportation-related injuries and deaths by utilizing a systems approach to bring perspectives from planning, engineering, public health, data science, and robotics to the road safety field. We are one of two national centers with a designated focus on transportation safety and the only national center with a focus on the safe system approach. We bring together staff, faculty, and students from different UNC departments, as well as those at our partner institutions that you see here on the slide. Just a bit of housekeeping before we get started. I'll remind you that all participants during the session will be muted, but you do have the ability to talk to us, to submit your questions using the Q&A box. We do have some time set aside for discussion at the end of the presentation. We are recording the presentation today, and CSCRS will make that available to you along with the slides at a later time. And one helpful Zoom tip, you can choose the speaker view option at the top of your Zoom screen to optimize both the screen of the speaker and their video camera as well. So with that said, I'll ask Jill Cooper to go ahead and pull up your presentation, please, and take it from here. We're glad to have you.
Yeah. Okay. Great. Greetings, everyone. First, I want to let you know that I know my voice might not be at its best, but I think the AirPods amplify sound well enough, so you should be able to hear me well enough. Thank you very much to the CSCRS team for inviting me to present this research project. This project focuses on assessing how private beliefs conflict with public action on safe systems, and how at its core, addressing these beliefs can promote safe systems. I'm Jill Cooper from UC Berkeley SafeTREC, which is a member of the CSCRS consortium. I want to first acknowledge the project team, Sapla Janess, from UNC and the Highway Safety Research Center led the project, and the team at UNC and/or HSRC. He and his team covered the breadth of the project, including research design, planning, and implementation. They developed and oversaw a survey in North Carolina that I'll mention later. Auctions Nichols and I were responsible for a literature synthesis on the subject matter, which I'll delve into a little bit today. So today, I'm going to introduce the concept of pluralistic ignorance, or simplistically, the conflict between private beliefs and public action. This term is from social psychology, and we apply it to transportation today. Provide some examples from the literature to ground the concept. I'll highlight an important finding from the survey in North Carolina to highlight what they and what they think others think their transportation priorities are, present some ideas for future explanation. But first, what you might ask is pluralistic ignorance. Basically, it's this: when people mistakenly believe that everyone else holds a different position from their own, they may go along with a view that they themselves do not agree with, because they incorrectly think that most other people agree with the other position. So in these two graphics, in the first graphic on the left, you've got the kid who knows that's a picture of a mushroom, but is afraid to speak up because no one else is identifying it, and therefore they think they must be wrong. In the second frame, I acknowledge the very dated and problematic in many ways image on the right, but it demonstrates here that you've got a group of people sitting around a table agreeing to something as a group. I, the facilitator, the The chair is asking for opinions, everyone agrees, but individually, they're perishing the thought. They have very strong negative opinions. So we go back to the idea that one's personal attitudes are different from the majority attitudes, and then act according with the majority attitudes and not their own. So the basic question of this project is, how do people perceive the transportation system they use? What do they value? What do they think others value? How might their perception of those values be incorrect, and importantly, affect their thoughts, level of advocacy, decision-making, etc., for various innovations and improvements to the system? To get here, we work to assess how pluralistic ignorance of others' priorities, attitudes, and behaviors, such as failing to yield to pedestrians and marked crosswalks, driving well above the posted speed limit, etc., as well as participants' transportation aspirations, maybe to walk more, drive less, affect decision-making and values. 2, we aim to discern the degree to which pluralistic ignorance helps to explain patterns in transportation funding and programming. For example, if policymakers knew voters valued, for example, safety over congestion mitigation, would they prioritize safety over congestion mitigation in those examples? 3, communicate to policymakers and the public that equitable and safe access to services and community life may be more highly valued than what is commonly believed. So to get there, we had these research questions. What do survey participants most value for their personal transportation? What's most important to them? Freedom, convenience, safety, congestion relief, so on. How important is it being able to get places by foot, by bike, transit, car, to the people we surveyed? In other words, what are their travel mode aspirations? 3, how consistent or inconsistent are participants' own transportation values and travel mode aspirations with their peers? And to what degree do public values in transportation and travel mode aspirations align or not, in this case, North Carolina DOT's priorities and travel mode affordances? So let's turn to the literature. There's not a lot of literature on this in transportation, but there is literature in other health behaviors and other perceptions. And so we highlighted those and we can apply them to transportation. So here are a couple of studies on college-age youth and health risk behaviors. Hines and team surveyed students at a university in the Midwest. They inquired about the students' comfort with 4 health behaviors: drinking, sexual activity, smoking, and drug use. These students were asked about their own comfort and what they thought others' comfort was with these 4 behaviors. They were also asked what comfort they have and what they think others have with depictions of these behaviors in the media. Interestingly, they found that the students thought that other students are more comfortable with those health behaviors than they were, and that the other students are also more comfortable with how those health behaviors are depicted in the media than they were. That goes far in sort of understanding maybe the myth about binge drinking being so as prevalent as it is on college campuses. The next study looked at exposing pluralistic ignorance in order to reduce alcohol use among adolescents, and this was super interesting. In this study, the authors conducted an experiment to assess if educating students in a group activity about the effects of pluralistic ignorance on drinking patterns, sort of a meta discussion about pluralistic ignorance, would have an impact on social conformity to observed norms. The experiment compared two groups of students at Princeton. One group was a group of freshman undergrads who participated in a discussion that focused on the relationship between pluralistic ignorance and drinking. And then the other group was a group of freshman undergrads who participated in a discussion that focused on making better individual choices about drinking. After a period of 4 to 6 months, the group participated in the discussion focused on pluralistic ignorance reported lower weekly alcohol intake, and the undergrads who participated in the discussion focused on individual choices. Excuse me. This has really interesting applications to how we think about strategies for educating students and others around issues related to transportation safety. The next set of studies we looked at had to do with climate change. In this case, was climate pluralistic ignorance as a barrier to climate change discussion. And there were 2 studies used here also to investigate the relationship between pluralistic ignorance and interpersonal discussion. The first study measured the effect of individual perceptions of others' opinions on climate change, on their decision not to disclose their opinions on the matter while they were discussing the subject with others who disagreed. The second study used surveys and observations to assess the elasticity of the pluralistic ignorance effect on self-silencing. They did find that pluralistic ignorance affects a student's willingness to disclose their views. However, they also found that taking measures to address pluralistic ignorance may help to minimize this effect and minimize self-silencing. So related to the previous study about college-age drinking, the idea about bringing in and talking and making conscious the idea about the conflict between private beliefs and public thought and public action might be an important strategy toward education. In the context of this project, we aim to reveal gaps between what members of the public most want from their transportation system and what they believe others, including policymakers, want from the system. So to address that, Seth and his group surveyed 1,000 North Carolinas, closely aligned with North Carolina adult population, according to age, sex, and income. They used Qualtrics panels to get the survey sample. They looked at values such as travel mode aspirations, how important it is to be able to get places using different modes, driving, walking, bicycling, transit. How important is that to the individual? They looked at time affluence, looking at how leisurely one considers how much leisure time one has in their life, how rushed they feel, how that affects transportation habits. Travel mode habits, how much is one's dominant travel mode automatic and routine, or how much effort would be required not to get places by walking or driving or doing whatever that person habitually does. So I'm going to highlight a major finding from the survey. The 2 next slides will focus on these results. What we found was that people are less concerned about congestion, getting stuck in traffic, relative to other values. They valued freedom, comfort, injury, avoiding injury, and getting stuck in traffic was less. That was surprising because, of course, congestion is a huge part of what many of us consider to be a major force in transportation planning. As you think about this, think about how this survey might reveal itself in your own states. Perhaps even more interesting, and again, I want to credit Seth for these slides. As you can see, being stuck in traffic had the greatest variation between what people valued themselves and what they thought others valued. So comparing what people valued with what they thought others valued, almost 44% of participants reportedly did not value avoiding being stuck in traffic as much, yet they believed others valued this much more than they had. I'll give you a second to look at this slide because it's really interesting. So the perception of congestion is that other people seem to care about it much more than they do. But if we look at the previous slide, people didn't care about it in compared to other priorities. For exploration, it would be interesting to explore how intervening by bringing pluralistic ignorance to the surface can help minimize self-silencing from the literature on climate change. To help minimize self-silencing, which we learned from the literature on climate change, and can help promote behavior change, as we learned from this study with undergrads at Princeton. If policy and decision makers knew that the general population cared more about avoiding injury than congestion reduction, how might this impact transportation planning? And then again, how might these results vary by state? That concludes my presentation. I'd be happy to take any questions you have.
Thank you so much, Jill. It's super interesting, and I can't say that I've ever really seen some of the pluralistic ignorance work kind of applied in transportation and safety in this way. So it's super helpful, and seems like it fills a big gap in the research from what you shared. I'm kind of curious to know, sort of big picture, it does seem like a lot of your findings and a lot of the survey results were sort of help reveal some of those individual community member preferences around safety compared to other values. I'm kind of curious to know if you're aware of, or if you see an opportunity to apply a similar type of survey or set of questions within agencies or within road safety professionals to begin to, I have the sense that there might be biases that other people sense others have around, say, doing more pedestrian bicycle oriented work or complete streets work, things like that, that could maybe be unpacked and revealed in some way by looking internally at agencies themselves and the people who are working for these agencies. Do you see any connection there, or maybe that's a future research topic?
I think that in terms of any particular findings from the survey that might speak to that, I'll defer to Seth Lajeunesse. But in terms of further research, I was really interested, as a person who's worked on the behavioral side of traffic safety transportation planning for so many years. I was really interested to think and to see how the idea about talking about the fact that others, might not think the way you think they do, and therefore you can act, you might not be, a lone duck. I think that has tremendous bearing on what happens both within an organization and within, any kind of community or group.
Yeah.
Does that answer your question?
That does. It does. And it gets to this next question. Someone's asking, is pluralistic ignorance, I'm having a trouble with that word, pluralistic ignorance, is it the same as what we used to call, or maybe still call, groupthink? And that's a term maybe others are familiar with. Do you see a kind of a synonym there in terms of the terminology?
What I think about groupthink, and I could be wrong, is that, when someone feels pressure to go along with the group or peer pressure, I think I think it's similar. I think this is a little bit more nuanced because it's the sense of, let me go back to the very beginning here. It's the sense that you think a certain way, others think a certain way, so you must be wrong. That's similar to groupthink, but I think there's another layer of thinking that there's more of a separation of one's thought and being from another, but it could be related as well. So
there's a question here. I don't know if you have the answer to this, but it's an interesting one to think about and maybe talk about is how do we encourage the person who is going along with the herd having that cognitive dissonance to be brave enough to speak out? And that may be from a perspective of I'm thinking of a planner doing some engagement and doing some planning and trying to get residents or community members to give their feedback, and helping that person get away from that mindset and really provide that pure kind of really, this is how I feel and what I value, and that input. It must be a tough thing to just overcome.
I think I don't want to be too simplistic about it. It's certainly a tough thing, and it could mean job. I mean, there could be a lot of repercussions from that. But I think that when appropriate, what we learned from the research, identifying the phenomenon can help. I think people, help the participants in the various studies feel safer to not self-silence. Yeah. So I think identifying the fact that maybe not everybody thinks this way, there may be unpopular views, might be a way to go around that. Again, I don't want to be too simplistic because in every situation is a little bit different. These worked within a classroom, within classroom settings, which is different from certainly professional meetings. Yeah. That
makes sense. Another question here, getting back to some of the survey, and I don't know, if Seth, you want to jump in for any of these, there are some coming up about the survey itself. They say that when they ask their residents about these kinds of questions, people will say, yeah, I'm all for safety. But then when they see what a trade-off might be associated with making a safety improvement, the impact on things like congestion or some other factor, that may cause them to change their minds a little bit or change the way they would rank, I guess, their priorities. And so this person is wondering how we go about, presenting the options as sort of all clear, separate choices versus the more nuanced of, if we make this change for safety, this may happen to congestion, and that push and pull always seems to be a struggling point there for community members.
So is the question how to balance it, or?
Yeah, maybe how to balance it, and in the minds of the people responding to the survey, it may be something we can talk about with respect to the design of the survey, but it seems like people are maybe picking or ranking these as how much do they value one over the other, but they may be interrelated in some way. The safety change may have something to do with how much congestion or perceived congestion there may be, for example. It seems like a really tricky issue, but I think I understand where the person's coming from in terms of it may be an initial in favor of this, yes, but when rubber meets the road, maybe it can change the perception of it.
Yeah, I would defer to Seth about the survey results, but I think in general there are trade-offs, and I think that I think it's important to not simplify what transportation planning will do. I also think that we have too often a very narrow definition of what a certain transportation planning job will do and what effect it will have. And of course, we all know that decisions we make affect much more than a single roadway, whether it's to improve safety or to improve or to provide congestion relief, that there are ripple effects or unintended consequences from all of these decisions. So I think really being able to see larger patterns. What are the transportation goals for a region, and how does this project help meet those goals? And having people understand that. There's also the situation where you're going to have, I think that the people who are most vocal may be the people who have minority views. And so how do transportation planners seek out the voices that aren't being claimed, because they're users of the transportation system too?
I see. That's a good point. Seth, anything to jump on there before I ask you? I have a couple more questions for you before you go away.
Sure. No, Jill's very capably responding to a lot of these questions, and thank you, Jill.
Definitely.
And the presentation too is fantastic. So yeah, this question related to the values. I mean, we designed this to be situation transcendent, to not speak to any particular project. It was ranking these. It was a rank order task. Where would you place these? And people, they were pretty consistent. For the most part, people did want freedom and choice in how they got around, and then they wanted comfort and they wanted to avoid injury. Those are the top three by far. But yeah, it's true. Every situation is going to have these conflicting values in them. I guess it really relates to how different transportation agencies arrange themselves. If they, for instance, if you look at the results of this, you would maybe be cued to provide more choice for people, to look at the safety of this, and maybe your weighting schemes for priority, right? Rather than focusing so much on throughput or congestion, because that did seem, relatively speaking, something that wasn't nearly highly as valued.
Yeah.
So that's just one thing. It's more about sort of the strategy or planning, I suppose you could say, rather than speaking to specific projects.
Right. That makes sense. A couple of, I think, maybe quick follow-ups for you to weigh in on, Seth. Some folks are asking about how you reached the 1,000 people. Seems like an impressive number of people who responded. So if you had any insights there on how to get the survey, how you got the survey out to folks. And then another one is, did you differentiate any results between like an urban and rural split between where folks lived and maybe how they answered these questions?
Yeah, both great questions. The first one, we partnered with Qualtrics. UNC has a sort of arrangement with them. They were wonderful to work with. Once we paid them, they have what is called panels. Some people might be familiar with Amazon Mechanical Turk. It's something like that. People sign up for these. And what we did was give them some demographic markers and said, we do want to reflect the state population. They were able to help us with that. And we were even able to go back and forth a couple of times to mark some responses where there was clearly not a lot of engagement. They answered everything the same way, called satisficing. We were able to even get those updated and shoot right for that 1,000 participant mark. It's remarkable working with them, how quickly that can happen too. Relatedly, Dan, remind me the second question.
Yeah, it was, did the results differ based on whether a person was from a rural or urban area?
Yes, the results did. The values, not necessarily as much, but the aspirations certainly, and the modal, basically the modal habits. People in rural areas, as you might imagine, aspire to drive more than use other modes, transit. They might not be even available in the environment. And then they also drove more than the average, than the suburban or more urban participants.
Okay, great, thank you. And one question I might leave you both with, if you could both weigh in, would be interesting, is how do you see this, the pluralistic ignorance and what you learned from this project kind of being applied in other areas of safety research? It just seems like such an area that's ripe for more exploration. Are there other groups or questions that could be probed using this model in other studies that maybe participants here are working on, or projects they're working on? Any ideas there?
Yeah, Jill, if you have ideas.
Oh, sure.
Like you have some on this slide as well. But.
Yeah, I know I said this before, but I was really interested that from an educational perspective, the idea about making these kinds of, this phenomenon of pluralistic ignorance public, in the case of the college students, was more effective after 4 to 6 with following up in 4 to 6 weeks than educating purely about drinking behavior. So I do think that there is some that we really need to look at the relevance of how we address talking about safety. And I think that that's a super exciting outcome from my perspective.
Yeah.
And then also sort of, I mean, it's the emperor has no clothes kind of thing. It's like making public what people really think and what their values are and how they might be actually different from what is expected, both from a transportation perspective and from a community perspective.
Makes sense. Thank you.
Yeah.
Seth, anything to add on that one?
Yeah. Oh, yeah, Jill, I totally agree with what you're saying. And yeah, what really motivated this work, actually, I'll admit, was some work done in the UK around values more generally. They found that more people in the population there overestimated the value that others put on more extrinsic values like wealth and power. And they put a lot less value that they themselves actually value much more benevolence values like caring for other people. I thought that was kind of interesting. So why do we have this assumption about other people, right? And have sort of this negative view often of others. So we applied that to this realm. But I think Jill is totally right, is that it would be really great if we could just broadcast what people do seem to really care about, relative to other values. What do they have, and to what extent is this transportation system that we have now, is that actually responding to those values? So this is a kind of a next step in this process, is to go kind of public with some of the findings that we think, sharing it with some of those in our network, to really show people this is what people really do care about. And this is what they aspire to. That's one of the other findings from our work, is that we have a lot of the population in North Carolina that really does aspire to use various modes. They really do have more of a multimodal orientation. And I think we need more people to understand that, and hopefully decision makers be more open to hearing from the different groups, as Jill was saying earlier. Really, people you often don't hear from, they need to be part of the conversation.
That's great. Thank you so much, Jill, especially for your presentation, and Seth for weighing in. Really practical, valuable information here for everyone to take home. So thank you all. We ran a little over time. Hope you're not too late for your next meetings. We enjoyed seeing you here, and we'll see you again next month. We'll let you know what our next session is going to be all about. So until next time, thanks everybody. We'll see you later.